Mrs. Coughlin, you think we should continue the Coumadin for another day?
Yeah, I think we probably should keep it going, although we'll need to stop it when we put the feeding tube in her.
Okay. Well, we can't do that right away. I did call Ethics. My resident suggested I thought it was a good idea to get Ethics up here and get their opinion on this. And maybe once we get them up here and they write something in the chart, we could get that peg tube in if we're lucky by the end of the day.
Well, that would be helpful, but, you know, sometimes I worry that they don't always back us up or help us out or support us, so I hope this time they can come in and help us out with this.
Well, there's no doubt they do complicate things sometimes, but I think we need some help this time.
Gentlemen, I'm the ethics consultant, Jacque Jones.
Hi, Dr. Smith.
Dr. Smith, nice to meet you.
On the case.
Dr. Davies, I'm the neurologist.
Nice to meet you.
Nice to meet you,
And you said
too.
your name was Jones?
Yes, Jacque Jones.
Very good.
Yes.
Are you a physician?
I'm not a physician, no. No, my background, I'm a lawyer, but I also have a PhD.
Good, we could use a lawyer here.
Yeah, well, I mean, sometimes the issues are legal, but oftentimes they're ethical issues, so hopefully we'll be able to clarify these.
I don't know if, how much you know about the case, but we have this patient, Mrs. Coughlin. She's an 83-year-old woman. We know her well. We treated her before for stroke in the past. And she just had a stroke a little over a week ago. She's been here. At first it looked pretty bad, but she started to come around a little bit, but you know, one side isn't really responding yet, and so she has trouble eating, and we put a feeding tube in. She pulled it out. Now we want to put a peg tube in, so it's a little bit more permanent, and her daughter's, well, her daughter either doesn't really understand, she's not really behind us right now, so we could really use you to help us help her get on board here.
Yeah, you know, we really need you to back us up with this because we'd like to get the feeding tube in her, we'd like to get her going, but, you know, the daughter being reticent, that's where hopefully you can back us up and support us and we can get moving with this, and hopefully we'll get her doing better.
Okay. Now, is there a durable power of attorney for health care with this patient?
Yes, and the daughter
she's
signed it.
Okay, so she's a surrogate decision maker. And how would you describe the patient's mental capacity? I mean, you're the neurologist.
Mm-hmm. Well, before she had the second stroke, she was actually doing pretty well. She could make decisions for herself. At this point right now, she definitely cannot. She's responding to some touch and things like that, but she definitely cannot make decisions
And
right
we
now.
had psych up here, and they agree with
Okay.
Dr. Davies.
So she's really not even transiently able to make decisions. I mean, she's really pretty much...
Well, she can talk to you.
Okay.
But, you know, what she's getting, what she's not getting, it's pretty hard to say, and it varies a lot during the day.
Okay. And so, so we know that the daughter's a surrogate decision maker. The patient really doesn't have decision-making capacity. The medical facts, from what I understand, is that she's had a stroke. She has Parkinson's, right?
Right, yeah, she's got a number of long-term problems.
Okay. And then what was she most recently admitted for?
It's for this most recent stroke. This
Okay,
is her
for the
second
stroke. Okay, all right. And so then the medical problem here is that you want to provide her with nutrition through a peg tube, right?
Right.
Because she's not able to swallow.
Well, you know, she can swallow. Her daughter feeds her, and we thought that it was going to be okay at first, but as I said, the one side doesn't really respond, so, you know, she inhales her food, and she's had one little bout of pneumonia that we're getting her over right now, and if she keeps eating through her mouth, she's just going to keep getting pneumonia, and that could kill her.
Okay. And so, she has been able to feed orally, but there is this risk of aspiration pneumonia.
It's a pretty significant risk.
Okay.
We've already treated her once for it, and we know that anything she swallows pretty much goes right into her lungs. So it's a pretty significant risk for her.
Okay.
It could indeed kill her.
So, because, I mean, the daughter, I mean, she probably wants to do whatever is in the best interest of her mother, or at least have some sense of what her personal preferences are with regards to feeding. Has she expressed any kind of indications to whether she'd be okay with inserting a peg tube as opposed to doing some kind of oral
Well,
feeding?
you know how families get. It's hard to know how much they understand, and she's very reluctant to keep upping the amount of treatment, but it's very hard to say what's going to happen with the patient at this point. I'm not sure how much of that the daughter understands.
So, and have you included her in these conversations? I mean, these...
We've each talked with her a couple of times
Yeah.
individually. We haven't talked with her together.
Okay. And so what's been her response?
Well-
First to the medical facts, and then to some of these other issues, these ethical issues that you perceive them to be.
I mean, she seems to understand that anything her mom swallows is going to go into her lungs and that could injure her, but she just is very hesitant and actually refuses right now to put in the feeding tube, and I'm not sure she totally understands that her mom will starve to death because we can't let her eat because she's going to inhale it and it would kill her that way. So we're just trying to get her to understand that the only way for her mom to eat is going to be through the tube. And, you know, if she doesn't want to do that, this lady's going to starve to death, and I can't let that happen. That's never happened with one of my patients. So that's where we're hoping you'll help us out with this.
Well, and she's a nice woman, but you know, understand she's very emotional right now. She sees her mother pulling the NG tube out. I'm not sure how much she understands how different a peg tube would be. So,
Okay, so just to, I guess, paraphrase what I'm hearing from you two, this patient has a lot of problems, a lot of medical problems, and the big issue is nutrition. And the NG tube just isn't working, right? So you two both are on the same side as far as this, the peg tube insertion. You both want to insert a peg tube, right? And you're not clear as to whether the daughter is going to go for this. I mean, you don't think she is. And then you want me to basically support your view, right?
that's what we hope.
Okay. Well, I mean, I can just tell you a little bit about, I mean, the legal facts, as far as I understand them, based on what you've told me, is that, I mean, she does have the legal right to make decisions for her mother, and that could be refusing treatment. I mean, even life-sustaining treatment. So, I know that you know, you may not be comfortable with that kind of result, but that's her legal right, and actually her ethical right to do that, because she's the surrogate decision maker in this case. So, that having been said, I think the real issue is to include her in this conversation, because it seems like it would be helpful perhaps for all of us to sit down, have her in the same room, talk to her, and explain to her what you've told me about the significant risk, because you think it's a significant risk, and let her think about that and mull that over. Now, granted, I mean, she still has the right to refuse whatever treatment you offer her. But if you explain it to her, what those risks are, perhaps she'll understand and think, well, maybe this isn't the best way to, maybe oral feeding isn't the best way to feed my mother. Maybe we should go with the peg tube. But again, we don't know what the mother's preferences are. We're going to have to talk to the daughter. She's basically her spokesperson at this time. And so we're really going to have to just base our action on what she thinks and how she feels about this situation.
So you want to have a meeting then?
I do want to have a meeting.
I guess you'll set that up.
I will.
Okay, good. And you said you're a lawyer. Then do we need risk management, or is that we don't need?
Yeah,
a
I think it's premature right now to include risk management. I mean, they're really concerned about legal liability issues. I think this is really more a clear-cut case of just you know, who has a legal authority, and it seems clear that she does. And then ethically, is it appropriate for her to make these kinds of decisions? And I think, again, I think it is appropriate, but a lot of what I do as a consultant is really facilitate communication. I mean, provide you with some kind of knowledge, but really I want to be here as a resource for all of you to better communicate with the patient, vice versa.
That's great. We appreciate that. If you could set that up today, though, because as you know, with nutrition, every hour counts here. So
Yeah.
You have our pager numbers.
Yes,
Just let us know.
I do. Okay.
Great.
All right, well, thank you.
Thank you.
Okay, thanks.
Thank you.
Sure.
Yeah. Well, I hope that helps us out. You know, I'm a little frustrated by what he said. I don't think it's really ethical to let someone starve to death, but I guess we'll see what
They come
plays
up, they
out.
talked about rights right away and everything, but what are you going to do? It's our best shot right now.
Oh, what can we do?
Okay,
Okay, well,
talk
we'll
to
meet
you
with the
later.
family and
Great.
we'll go over that.
Thanks.
Thanks.